So thread lifts, which we are going is, what is basically thread lift? It's a cosmetic procedure to lift and realign the sagging tissue. So the purpose of threads is lifting and realigning of the sagging tissue, and they will add definition to the facial contour, especially the lower face. So wherever we are dealing with jowls or lower face heaviness or lower face sagging, there threads are more helpful. Threads do not see the mid face, the upper face is basically the Botox domain. Mid face is basically the
Fillers.
normal fillers domain, and the lower face is, if thread lifting or sagging is there, then it is a particularly a thread lifting domain, and then followed by fillers.
Like, ma'am, how do we know, like, if we see once, like, if the patient is having
Jowls,
sagging?
if there are jowls, if you can't see the jawline well defined, and there are marinette lines, then obviously you have to, deal with that. Is the lower face sagging, signs of lower face sagging.
Okay, so we have to go. Now, how do you know, ma'am? Okay, this patient requires fillers and this patient requires thread lift. That is
That
by
is,
this. What?
huh. So the indication wise, there, see, if there is tear trough, you cannot do thread lifting. If there is nasolabial fold, thread lifting has very little role to play. So when you go into etiology or formation of each of the aesthetic concern, then only. So if the aesthetic concern is because of volume loss or bone resorption, then threads won't be able to do anything. So
Okay.
with aging, what is happening is everything is descending downwards and forwards. So
Okay.
downward and forward descent is, something which we want to deal with the thread lifting. So
Okay.
every aesthetic concern, you have to know what is the contributing factor for that aesthetic concern, be it tear trough, nasolabial fold, cheek flattening, malar flattening, mentolabial crow's, mentolabial fold, marinette lines, jowls, all these things.
Okay.
You haven't done the dermal fillers sessions with me, no?
Oh, ma'am.
And that's why we do, all the things. So these are
Okay.
manufactured of the same material used in surgery for wound closure. And it's basically the suture material. That is what it is
Huh.
made. And depending on the layer in which they're inserted, they can tighten the tissue, they can lift the tissues. And thirdly, volume by collagen induction. So when you insert threads, there is some amount of collagen induction because it's causing, some kind of tissue injury. So by secondary effect, it might contribute to adding some volume, but that comes after certain period of time when collagen fibrils are deposited around the threads. So the primary purpose is to lift the tissues or tighten the tissues.
Okay.
Now, 3 steps before any thread lifting procedures. First, you have to see what type of thread it is. Secondly, a patient selection. And thirdly, type of thread for the concerned individual for their specific concern. So you have to know what type of thread. There are cogs threads, there are PDO, mono threads, there are double screw threads. So what is the type of thread? Then patient selection. Patient selection, how do you do? You see the degree of severity of the aesthetic concern. How severe is the jowling? How severe is the jawline blunting? How severe are the nasolabial fold? And that can, give you a good idea. See, for mid face also, you can do threads, but primary, lower face heaviness or lower face sagging is something which most of the fillers are not able to give. Most of the
Okay.
aesthetic concern in the mid face can be dealt with fillers, but not in the lower face, especially if it is sagging. So facial aging is a combination of skeletal changes and soft tissue changes. And thread do not contribute to skeletal changes. Now, what does that mean? So there are, with age, the skeleton is decompressing. I mean, it's deflating. It's, getting smaller in size. There is bone resorption. So as a result of which, their bony support is gone and the overlying tissues are left loose and they fall down.
Yes.
Right. So if there is orbital rim thinning or zygomatic, arch thinning, maxillary retrusion, mandibular retrusion, all these things can be compensated by putting a filler over there.
Okay.
So filler, when we deposit on the bone, when the periosteal injections are made, they are mimicking the effect of recreating the bony volume which is lost.
Ma'am, like I went for one training. So some doctors were, in this, she was doing it subcutaneously. I mean, she was giving the filler injection subcutaneous. So the patients get an immediate effect and also less amount of product is only required. I mean, so what do you say about that, ma'am?
All depends on, you have to analyze the aesthetic concern. If they're tear trough, if they are putting superficially, it's going to give an abnormal results, unnatural results. For tear trough, you have to have, it is formed because of the orbital rim recession and secondly, downward movement of the SOOF. So unless and until to address it with bony support, no matter how much you inject, it's going to, give an unnatural results because
What about CK1 and C?
CK1, CK2 is always with the needle, never with the cannula or never with in subcutaneous. It is always periosteal.
I mean, little rather than going deep, if we give superficial.
In CK1,
Yeah.
it doesn't make sense in CK1.
But this ma'am was actually doing it like that. So that's why I asked.
I don't think that is recommended. I don't know. She might not be from some brand or something.
She was one, I mean, she's using, ma'am. I mean, she used to use Allergan. And
Hmm.
now she's using that Akar.
Okay, I know. Safe up. No, that is not recommended, ideally.
Okay.
So the threads will not contribute to skeletal changes.
And which one do you prefer? Galderma or Allergan or
Allergen,
Akar?
any day allergen.
Okay. Okay.
Allergen first, then everything else comes second, whatever is available.
Okay.
So threadlifts intend to deal with soft tissue changes associated with aging. So basically, we are only dealing with the soft tissue changes, not the periosteal changes. So if I have a young patient in which bony resorption is very little, the contribution of bone is very little, then in that case, I can do, but still CK1 is always on the bone. It's never,
Okay.
it's never. Subcute you do, first you do bone, and then next session, if you want more highlighted cheeks, then you can do subcute with the cannula over the bone points. But never, like first attempt has to be always only periosteal. Not other. So these are the soft tissue changes that are associated with aging, which we are dealing with threadlifts. So signs of aging that can be dealt with threads. First is the poor definition of mandibular margin. All these are lower face indications. Right. Now, why is mandibular margin poorly defined? Depends. If the patient is in 30s, then it's because of overactive or hypertrophy of masseter. It could be sagging of the tissues, or it could be lower heavy face. So in that case, the mandibular margin will be ill-defined.
Okay.
And if it is elderly or senior age group, then obviously it is sagging of the overlying tissues, mid-face fat pads sinking down and then encroaching the mandibular zone. Drooping of the zygomatico-malar region. The cheek drooping, the superficial fat pads in the cheek, they start drooping and they come down in the lower face. So that will cause blunting of the mandibular margin. Deepening of the nasobuccal fold, which is the nasolabial fold. Ptosis of malar fat pads and facial soft tissues, which create hollowness in mid-facial region and infraorbital region. So the cheek fat pad, malar cheek fat pad will come down. As a result of which, the hollowness is created in the cheek as well, anterior malar region and tear troughs. Infraorbital
Okay.
and anterior malar region. Now, age-related brow ptosis. We all know with aging, the brows become flat and straight. They lose their arch and definition because the skin loses its elasticity and laxity. The underlying support to the skin, the fat pads and all, they are also drooping down. There is bone resorption in the forehead, right? So all these changes contribute to the age-related brow ptosis. So if you want to lift the brow, there are many techniques. You can do it with filler also. You can do it with Botox. You can do it with thread lifts. All the procedures have their pros and cons. Now, classification, it could be based on the mode of absorption, the type of threads, and the length of threads. The treatment protocols, basically. Design the treatment vectors with a marker pencil. Then use a pre-treatment antibiotic 1 hour prior to the procedure. And use antibiotics. So for cog threads, if the person is compromised, diabetic, hypertensive, or if any chances of infection, start them 1 day before with an antibiotic.
Which antibiotic? Anything, azithromycin.
Azithromycin is fine. So use of pre-treatment antibiotic 1 hour prior to the procedure, and use antibacterial products like chlorhexidine and betadine for cleaning the surface of the skin. Then for superficial plain threads, that means the mono threads, apply topical lignocaine 7 to 15% for 45 minutes before the procedure. That is for mono thread you're doing.
Okay, ma'am, which topical lidocaine do you use, ma'am? Anesthetic?
No prick is there, top lap is there, Prilox is there. So many is there, whichever is available.
Okay. No prick is good, ma'am.
No prick is good, yeah. With top lap, what I have found with the problem was that the skin used to become sensitive and redness used to develop. With no prick, I don't have such issues.
Ma'am, which company is that, no prick? I've heard that, but then...
I can let you know. I don't remember the brand as like that.
Okay, ma'am. Yeah.
For cogs and long threads, you have to use 1.1 to 2% lidocaine with epinephrine, which we administer before injecting the threads.
For cog.
So that LA has to be given.
Yeah. Okay.
Then there's short shoots. See, these threads will vary, the type of threads will vary from company to company. Different brands have different type of threads. So you can take briefing from whichever brand you're buying the threads. From there also, you can take some briefing. Right? So short suture threads could be there less than 90 mm. They include PDO, plain, screw, spiral, cogs, so many. Then the short suture threads with free floating method. So guidelines for each treatment area and the minimum number of threads. For lower face and jawline, this first step is, this is for cogs basically.
Okay.
So for lower face, you can place 5 cogs. This, again, different brands have different lengths of threads and all that. So this is in general a rough idea. So if only the lower face is there, then you can put either mono threads or you can put cog threads, 5 each side, small ones. The vectors, first you have to always draw the vector. For example, there we have a fold like this. So the vectors should be going above like this.
Okay.
And first draw the vectors and then insert the threads beneath those vectors. So markings have to be done before itself.
So, ma'am, it's not from here. We put
There's some crocs with longer crocs. So if you have nasolabial fold, if you have marinette lines, and if you have jowls, then of course you use croc threads from here, 5 each side.
So if only this type is...
Yeah.
This is for my shown.
Only marinette line, only chin area, only marinette line in isolation if you're doing.
So we have to put the needle from, this is for cog thread, no ma'am? So only from where do we prick it?
See, and you can make entry point, you see the length of the thread, and wherever you save the length of the thread, you can entire length of the thread, you can go, and then you can start. Cogs also, you can start from here also, 3 you put from here and 2 you put from here.
Okay. Okay. So this is like each point 1, 1. It's not from 1 point E.
No. This is each point 1. This is for mono threads.
Oh, this is for mono threads. Okay.
Okay. With cogs, you have to make only 1 entry point.
1 entry point. That's what I got confused. This is for mono threads, and if the patient is having jowls and the mandibular area is not visible, ma'am, result will be there with mono threads?
Little bit. Not as good as cogs, but it will be there.
Okay, ma'am.
And with cogs, the results will be faster as compared to mono, because Mono, the results will come only when there is collagen deposition surrounding those fibers, which is a much longer process. There is no physical lifting. With cogs, there is actually physical lifting. So for skin tightening, insert into dermis, and for lipolysis, insert into subcu. So for the mono, they say if you want skin tightening, you should be able to see. I mean, the needle, the entry point should be creating a trail over the skin. You should be able to see. And in subcu, just a blunted end you should see while you're inserting the mono threads for skin tightening. If you want lipolysis in the sense that the facial fat is more over here, because with aging, what is happening? The mid-face fat is losing volume. I mean, the superficial fat pad is lost, and in the lower face, it's gaining volume. So if you want to reduce the facial fat, two things are there. One is HIFU you can use, and the other one is sub-Q insertion of the mono threads. I'll share the recording.
Okay.
This is for cogs. There is only one entry point.
Okay.
So you do 3 like this and 2 like this, or you can entry points can vary. It can be either here or here. They can vary. Here it is a pre-auricular. If you are doing into the SMAS, this is a step 3. Like when SMAS is there, you need to tighten the area. Lifting is not required, only tightening is required. Then you create a grid with mono.
Only tightening, not lifting. Okay, yeah.
Not lifting.
So we can do both cog and mono threads together, ma'am.
Yeah, in the same session you can do.
Okay, if they want more of
tightening. Like if you have done cogs here, then don't put mono over here. Put mono somewhere else.
Down. Okay. Okay.
Or you can do also because the layer is different. Cogs are deeper.
Deeper.
Mono are superficial. And when you do cogs, there will be complete numbing of the area because you've done anesthesia over there.
Ma'am, then like when we're doing, I wanted to ask you something. We should not cross the nasolabial fold when we're doing cog thread?
No, not medial to it, always lateral to it. Then only we are able to
lift it. Okay.
And the anchor point is always the bony point. That is the zygomatic arch is there. Yeah.
One point, ma'am.
One point, anchor point.
Okay.
Anchoring point is always either the bony point or a tough ligament.
Okay.
So formation of mesh gives a lattice framework. So when you're doing PDO, it gives a lattice framework. Now for mid face, that was previous one were lower face vectors. Now mid face and cheek, insert 4 to 6 cogs per side in the SMAS plane. Right. Now SMAS plane is a plane in which the cannula moves freely. There is no resistance.
Sub-Q, there will be resistance.
Sub-Q, there will be resistance.
Okay. So SMAS is beneath, no ma'am. So first the sub-Q comes, then the SMAS comes, no ma'am.
Yes. On the top is sub-Q, and then is the SMAS.
Okay. Then comes the muscle.
Yeah.
Right. So in this, which indication we do, ma'am, for mid face? Which indication? Same sagging.
Yeah. Anyway, so step 1 is insert 4 to 6 cogs per side. Right. So next is that step 3, insert 3 to 5 mono screw or mono screw threads per side. That is a step 3. So first step is insert 4 to 6 cogs. Right. This is we are doing for mid face and cheek. When we are doing mid face and cheek combined threads, first is do cogs first. Then next is insert mono screw threads. And third is 3 to 5 mono screw threads each side. And then, okay. So first you insert the cogs, and on top of it, you can insert mono. If you have the budget, if the client is ready.
Ma'am, what's the difference? Like the mono threads,
Tightening.
screw threads.
Screw threads are basically, they can, anchor, they give more anchorage.
Okay, it is a mono thread. Screw threads are mono threads only.
No. Mono are just plain. Mono are not creating anything. They're just collagen will accumulate around those. But screw, because
Okay.
it is, spirally made, they can give some amount of lifting also. But they don't have any anchor point. So they can be used in any direction. There are no directional vectors are not there.
Wherever we can put.
Yeah, wherever you need tightening, a little bit of tightening and lifting. So for the periauricular area, the medial and lateral eyebrow lift. Usually threads are done in this area for the lateral eyebrow rejuvenation. That is the lifting of the lateral eyebrow. But here you have to be careful that when you do threads, if you pull it laterally, then it will give a cat eye or fox eye. And if you pull above, vertically upwards, then it will give a surprised look, which will gradually soften with time. So that's why I don't prefer threads for brow lift. I'd rather do with Botox or filler. Right? Because threads, if you've done, then you're stuck for 6 to 8 months with that kind of a look. Now, there are some models, some individuals who prefer that fox eye look. So that is fine. But normal, individuals moving around here and there, they don't appreciate that kind of a look. If they're coming and asking for a fox eye or cat eye look, you can do.
Okay.
So these are the various vectors. You can go. I'll share the slide and the recordings also with you. Different vectors. The location, the entry points, the point where you can take leverage and anchorage and all that. Under eyes, we don't do, crow's feet also, we don't do threads because it's high chances of bruising in that area.
Okay.
Now, when it comes to crow's feet, here they have written crow's feet, but usually don't attempt that. Just do threads for either skin tightening or lower face lifting. You can use 5 mono threads, 30 mm, 31 gauge, dermis, meshwork, 3 horizontal, 2 vertical, something like that for crow's feet. But they are two very small threads.
Acne scars, mono threads.
Yeah, they'll work. Acne scars, mono threads will work.
How should we do that, ma'am? Like meaning how?
Resistance, when you do in acne scars, there'll be a lot of resistance. Okay. Because a lot of additions and a lot of fibers there. So do subcision first, and then you insert the thread.
So threads we insert superficially, mono threads, but this is subcu. How?
You can superficially into the dermis or subcu, both will work. Depends on the depth of the scar.
But then we are doing subcu, subcision we are doing subcu. So after that we have to inject there only.
No, little superficial.
Superficial. Okay.
Right? Because what happens is if you put the thread in the subcu, mono won't be able to do anything. So if you're putting cogs, then what happens? Sometimes the cogs will tighten the skin beneath and the scars will become more prominent.
Okay.
So you do subcision and you insert the threads superficially only into the dermis.
How many should be at a time? Like how many?
You can put 15 each side mono threads.
Or 10.
10 is also fine. See, everything depends on the severity of scars, the age of the patient, the associated sagging. There's so many parameters that you need to look at before planning any thread lift procedure.
How many times should we do, ma'am? Like if you do one procedure today, like within how many months we'll get the result?
You'll able to appreciate the results within 20 to 25 days because neocollagenesis takes 21 days.
Okay. And how much should we charge, ma'am, for mono threads?
Depends on the brand, because they have different variables.
Aphrodite.
I have no idea about Afro, right? So whatever the cost of the thread, multiplied by maybe 2 times or 3 times. So if
Okay.
it is like, 5,000 for the threads, if you're paying 5,000, for example, then you can charge around 15,000.
Okay.
So because
So
it,
like do it. I mean, once we did, we got the result. Some kind of result we got within 20-25 days. Should we repeat it again after 1 month or 45 days?
no, not required. You can put other treatments, but not the same treatment.
Because I have a patient, ma'am. Like I did multiple times of for the scars only. I have done micro needling, PRP, everything. But still scars are there. So I was like thought of doing this one. Should I go
Mono.
for this? Mono threads.
Mono
So with
thread.
one sitting difference, I'll send you the photo.
Send me the picture with one sitting, mono threads each side, 15 each side would be sufficient.
He'll get okay. Okay.
So then there is neck area. Neck, we usually do the pre-jowl or double chin. They create a tightening effect. You use mono screw, you can use mono threads and mono screw threads. By creating a meshwork, you can tighten the jaw, the submental area or the double.
Okay.
How are you not usually done?
Oh,
So this is how you short suture for submental fat pads. Create a meshwork, either double screw or mono, whichever is more. So protocols for long suture, that is more than 90 mm. Most long sutures are barbed, bidirectional or unidirectional. So these are the vectors for which So anchor point is always bony point, and then. So the first picture is of a cog thread. The second is double screw, right? The third picture shows
okay.
the angle of the mandible, and the fourth picture, the red line, is the vector, basically direction of the vector in which you will lift.
Ma'am, bidirectional, unidirectional, what's the difference?
Bidirectional is that they will create both. They will tighten the skin from above and below both. And unidirectional is basically you're creating a vector, pulling in one direction.
Okay. That means unidirectional means like we put it from here and we pull it.
Yes.
But
Yes.
the other one, we from here, from wherever we want, that's what.
From here, remove, take it out from here, and then pull from both the ends.
Oh, that is bidirectional. So both the sides are, okay.
So these are the various vectors and the direction in which you need to insert the threads. So unidirectional, a fixed technique with one anchoring point.
The anchoring point means what, ma'am?
This is the anchoring point, no bony point or the skeletal, wherever. Suppose we have to pull something from we are on a hill, we have to pull something upward. So we tie the rope to a stone, a big stone. So that is the anchoring point basically.
So for bidirectional, there is no anchoring point.
There is no anchoring point. For unidirectional, there are vectors and there is my anchoring point. So anchoring point, usually we cannot reach the bone, but it is a tough fascia. Fascia acts as the anchoring point. So wherever the fascia is strong and tough, that point acts as the anchoring point. That means the entire thread will be hanging from that point downwards, and it will be creating a lift unidirectional.
Okay.
So for fixed methods, 3 to 4 incisions for insertion of straight needle. This is a different, this is surgical.